Good morning, I'm Jeanne Tung, one of the pediatric gastroenterologists here at the Mayo Clinic. These days, everybody seems to have a coach. I used to think coaches were just for sports, but now you hear about coaches for lifestyle, fitness, and diet. So today I would like to talk to you about problem-solving coaching by telephone for teenagers with IBD. Researchers at the Medical College of Wisconsin and University of Chicago wanted to improve the adherence to taking oral medications for IBD by using this technique. So let me explain adherence first. The term adherence is used in medicine to describe how well somebody is able to follow the directions of their medical team. We know that successfully taking medications for IBD is critical to inducing and maintaining remission. However, studies show that up to 2/3, that's 67% of teenagers, may not be adherent in taking their medications. As our teenagers get older, it's important to take the responsibility away from parents and transfer that to the teenagers before they get to college. It takes practice, and so let's talk about these problem-solving skills to improve adherence. There are a number of factors that can affect someone's ability to take their medications. For instance, they may not understand the difference between their medications. Maybe you don't know that vitamin D is for your bones, but azathioprine is the important medication to keep your Crohn's in remission. Another example is that a patient may not understand that IBD medications need to be taken on a regular basis and not just when their IBD is flaring. As your medical team, we may not even have been good about explaining when and how you're supposed to take your medications. We know that the more complicated your daily life is, the more difficult it is to stay on top of things. Families are so busy these days, on top of carpooling for after-school activities, separate households for those that are divorced, and caring for multiple children, doses may get missed. In this study, patients who were taking pills for their IBD participated in a phone counseling sessions. There were 3 groups. One group took 2 sessions by phone, another group took 4 sessions by phone, and then a third group served as what we call a control group. The first session lasted 60 to 90 minutes for everyone, and other sessions after that took 45 minutes. There were 5 key steps to this problem-solving training. Number 1, developing a positive problem outlook. That means the attitude of we know that there's a problem in adherence and we can fix this. Number 2, formulating a clear and specific problem that you want to address. Number 3, working as a family and brainstorming possible solutions. 4, choosing the best solution that you brainstormed. And number 5, formulating a plan how you're going to work out that solution. Each phone counseling session was scheduled for 2 weeks apart. That way families had a chance to actually try their problem solving and then report back. The ability to take medications correctly, meaning the adherence, was measured by using electronic pill counters that were actually on top of the bottles. The researchers studied this method with 76 patients ranging from 11 to 18 years in age. Patients were taking an average of 3 types of medications a day. They didn't even mention how many pills that was, but that's already a lot to handle. Some patients were taking up to 8 medications for their IBD or related side effects. 37% started with perfect adherence. In children who were not as good about taking medications, researchers saw an overall 6% increase. Interestingly, older teenagers improved by 10%, while patients that were under 15 improved just by 4%. Families seemed to improve after just 2 sessions and didn't necessarily need 4 sessions. And interestingly, there was a slight increase in children and how they reported their quality of health in just this short time of the study. We don't know how patients that are taking IV medications or injectables at home would do in this sort of study. Overall, this study suggests that structured coaching for older teenagers and their families may be helpful in improving adherence. Families also save time and money by not having to drive to clinic for these sessions. This isn't something that most clinics can do right now, but it certainly makes us think of ways to be more innovative in how we provide these important life skills for our patients. I hope this was helpful for you today.